if we want to study the topic of consultation-liaison psychiatry in Italy, we can search PubMed with the following keywords: consultation-liaison psychiatry Italy, and this is what stands out. As you can see, there is an increasing number of publications on this topic, and they start in 1978. So it seems that 1978 was a very important year for Italian psychiatry and for consultation-liaison psychiatry in Italy as well. 1978 is the year of Act 180, the so-called Legge Basaglia, Basaglia's Act, after the Venetian psychiatrist Franco Basaglia, who would be 100 years old this year. This act was revolutionary because it represents a great divide in the history of Italian psychiatry. There is a before, that is the asylums era, and there is an after, that is community mental health, and for the topic of this morning, consultation-liaison psychiatry. But what it is important to stress is that thanks to Act 180, psychiatry found itself next to the rest of medicine. This especially inside the general hospitals. Psychiatry found itself next to medical wards and next to surgical wards. So Act 180, Legge Basaglia, stopped new admissions to psychiatric hospitals. Actually, psychiatric hospitals were closed in Italy in 1999, so more than 20 years later. And following this year's motto, this act gave Italian psychiatry a chance to be open and inclusive. This is not necessarily a truth. It gave a chance, a possibility to be open and inclusive. This slide sums up very briefly what I'm presenting you, even from a legal standpoint. The asylums era was rooted in the 19th century and was ended by Basaglia's Act in 1978, which was not a finish line, it was a starting point for what? For community mental health in Italy. And as you can see, there are many other laws and regulations and acts that I will present in the next slides that deal with the topic of my presentation. And as you can see, there is a question mark at the end of the arrow that refers to some critical issues that Dan presented in his presentation concerning Switzerland, and many of them concern Italy as well. But I would like to draw your attention to the fact that what happened in the period of community mental health we are living in Italy. First, community mental health centers-based psychiatry was born. And secondly, small psychiatric inpatient units were established within general hospital. Before, psychiatric wards were in asylums, were in manicomi, and they were very big wards. After this act, we have small psychiatric inpatient units of 12, 15, 20, 25 beds according to the catchment area. So these 2 points represent the pillars for the development of consultation-liaison psychiatry in Italy. Act 180 has been ideologized in the last 40 years. It was a revolutionary act, it is true, but there were critical issues that needed to be addressed, and actually we still have some critical issues. For example, following 1978, the development of psychiatric services in Italy was not homogeneous. Some regions developed a network of psychiatric facilities, a virtuous network of psychiatric facilities that represented the model for the prototype of the mental health department. What is the mental health department? It represents the way psychiatric facilities are organized inside the local health agencies, both at territorial as well as at hospital level. Local health agencies are the structural and functional units of the national health system. So we have a national health system, we have regional health systems, and then local health agency at provincial level. This is the structure of the mental health department. As you can see, it is made up of 4 branches. Starting from the left, there is community mental health centers, then acute inpatient units inside general hospitals. There are no psychiatric hospitals. And then we have day hospital facilities and residential facilities. According to the regulations on this topic, consultation-liaison psychiatry activity is carried out by community mental health centers and acute inpatient units. So to overcome all those critical issues following 1978, in Italy, a first and a second plan were implemented. They are called Objective Mental Health Care Plan, and we are in the 1990s, several years after 1978. The first Objective Mental Health Care Plan implemented the model of the mental health department in the whole country. And the second plan identified new aims such as prevention and provided information concerning the way the department works and interplays with other branches of healthcare and other agencies such as municipalities and university. And finally, in March 2008, the national guidelines for mental health were approved. They integrate the first and second plan with respect to economic issues. So how about consultation-liaison psychiatry in Italy? The first plan states that the mental health department covers all territorial and hospital-based activities to assure integration with hospital and general medicine. And with respect to the hospital, it is important to stress the consultation-liaison activity inside the emergency department and inside non-psychiatric hospital wards. According to the first plan, community mental health centers provide psychiatric referrals to public general hospitals in the case that they do not have a psychiatric inpatient unit inside. And of course, in case they do not have a consultation-liaison psychiatry service inside. Community mental health centers are the nodes of the network of psychiatric services, and they have a filter function for psychiatric hospitalization. According to the second plan, community mental health centers provide even consultation-liaison psychiatry activity for primary care, so for GPs. I have put in this point of my presentation a definition of psychiatric referral because we do not have a standard definition of psychiatric referral. And I think it is interesting to take in consideration this one, which was released by the region where I live and work, region Emilia-Romagna, that states that psychiatric referrals are carried out upon request from other non-psychiatric departments. The consultation includes both clinical interview with the patient and the medical report for the department that referred the patient. So, this is a sort of sum up. We have 4 models of intervention according to the regulations I presented to you. Community mental health centers, psychiatric inpatient units, and consultation-liaison psychiatric services that may work part-time or full-time. I would like to dedicate the last 2 slides of my presentation to a topic I think is very important, which is the impact of consultation-liaison psychiatry activity on healthcare budgets. So, very quickly, a cost-effective analysis concerning the activity of a full-time consultation-liaison psychiatry service. As a measure of effectiveness, I included the length of hospital stay, which is one of the effectiveness measures you may find in the literature. And the association study was between time to referral in days and the length of hospital stay in days. The latency between the request of referral and the psychiatric assessment was less than 1 day. And we found that increased time to referral was associated with increased length of hospital stay. So, on average, psychiatric referrals made it possible to reduce the length of hospital stay by slightly more than 1 day. And if we consider that first, the mean cost of hospitalization per day is 600 euros, and second, that the mean number of consultations carried out by consultation-liaison psychiatry service was 1,000, we can estimate a theoretical gross reduction in the healthcare costs, that is the health budget of the general hospital where the study was carried out, of about 600,000 euros per year. This figure is absolutely consistent with what literature reports. Generally, savings are between $500,000 and $800,000. So this is to draw your attention on the economic impact of consultation-liaison psychiatry. So the conclusions, 4 key points. First of all, the birth of consultation-liaison psychiatry in Italy was made possible thanks to Act 180, Legge Basaglia. We should never forget this. Thanks to Legge Basaglia, psychiatry was and still is close to the rest of medicine, is inside medicine and not secluded in asylums. Consultation-liaison psychiatry activity in Italy is provided by several, let's say, institutions which are part of the health system. Fourth and final, please remember that consultation-liaison psychiatry activity positively impacts healthcare budgets. Here are the main references of my presentation that you will find if you're interested in on ResearchGate and also on my Instagram profile. And I really thank you very much for your attention.